COVID and travel. Frequently asked questions and answers. Can flying on an airplane increase my risk of getting COVID-19? Yes. Air travel requires spending time in security lines and airport terminals, which can bring you in close contact with other people and frequently touched surfaces. Most viruses and other germs do not spread easily on flights because of how air circulates and is filtered on airplanes. However, social distancing is difficult on crowded flights, and you may have to sit near others within 6 feet, sometimes for hours. This may increase your risk for exposure to the virus that causes COVID-19. Do I have to wear a mask when I travel? Masks are required on planes, buses, trains, and other forms of public transportation traveling to, within, or out of the United States, and in U.S. transportation hubs such as airports and stations. What happens if there is a sick passenger on an international or domestic flight? Under current regulations, pilots must report all illnesses and deaths before arriving to a U.S. destination. According to protocols, if a sick traveler has a contagious disease that is risk to others on board the airplane, they work with local and state health departments and international public health agencies to contact exposed passengers and crew. Be sure to give the airline your current contact information when booking your ticket so you can be notified if you are exposed to a sick traveler on a flight. Should I delay going on a cruise? Yes, it is recommended that all travelers avoid all cruise ship travel worldwide, including riverboats. Reports of COVID-19 on cruise ships highlight the risk of infection to cruise ship passengers and crew. Like many other viruses, COVID-19 appears to spread more easily between people in close quarters aboard ships. At this time, cruise ship passenger operations remained suspended in U.S. waters under CDC's framework for conditional sailing order. Can people who have recently recovered from COVID-19 travel? If you had COVID-19 in the past 3 months, follow all requirements and recommendations for fully vaccinated travelers, except you should show documentation of recovery from COVID-19 instead of a negative test result before boarding an international flight to the United States. You do not need to test 3 to 5 days after travel to the United States unless you have symptoms of COVID-19. We know that people can continue to test positive for up to 3 months after they had COVID-19 and not be infectious to others. Can traveling to visit family or friends increase my chances of getting and spreading COVID-19? Yes, it is recommended to delay travel until you are fully vaccinated because travel increases your chance of getting and spreading COVID-19. If you are not fully vaccinated and must travel, follow the domestic travel or international travel recommendations for unvaccinated people. Am I required to quarantine after domestic travel? It is not required travelers to undergo a mandatory federal quarantine. However, it is recommended that unvaccinated travelers self-quarantine after travel for 7 days with a negative test and for 10 days if they don't get tested. International travel. The data reported to the World Health Organization daily to determine a destination's COVID-19 travel health notice level. There are a few factors considered when determining the level of a destination. These notices offer travel recommendations based on the level of COVID-19 in a destination. How often are international travel recommendations related to COVID-19 updated? Recommendations are updated weekly. Review of data reported to the World Health Organization daily to determine a destination's COVID-19 travel health notice level and makes appropriate level changes once a week. What restrictions do other countries have in place that might affect U.S. travelers? Check with your destination's Office of Foreign Affairs or Ministry of Health or the U.S. Department of State, Bureau of Consular Affairs for country information. Is it required to take a COVID-19 test before coming to the United States? All air passengers coming to the United States, including U.S. citizens and fully vaccinated people, are required to have a negative COVID-19 test result no more than 3 days before travel or documentation of recovery from COVID-19 in the past 3 months before they board a flight to the United States. Is it required to quarantine after international travel? It is not required travelers to undergo a mandatory federal quarantine. However, it is recommended that unvaccinated travelers self-quarantine after travel for 7 days with a negative test and for 10 days if they don't get tested. Follow all state and local recommendations or requirements. Air or cruise travel. Can flying on an airplane increase my risk of getting COVID-19? Yes, air travel requires spending time in security lines and airport terminals, which can bring you in close contact with other people and frequently touched surfaces. Most viruses and other germs do not spread easily on flights because of how air circulates and is filtered on airplanes. However, social distancing is difficult on crowded flights, and you may have to sit near others within 6 feet, sometimes for hours. This may increase your risk for exposure to the virus that causes COVID-19. Do I have to wear a mask when I travel? Masks are required on planes, buses, trains, and other forms of public transportation traveling into, within, or out of the United States and in U.S. transportation hubs such as airports and stations. What happens if there is a sick passenger on an international or domestic flight? Under current federal regulations, pilots must report all illnesses and deaths to the CDC before arriving to a U.S. destination. According to protocols, if a sick traveler has a contagious disease that is a risk to others on board the airplane, it works with local and state health departments and international public health agencies to contact exposed passengers and crew. Be sure to give the airline your current contact information when booking your ticket so you can be notified if you are exposed to a sick traveler on a flight. Should I delay going on a cruise? Yes. It is recommended that all travelers avoid all cruise ship travel worldwide, including riverboats. Reports of COVID-19 on cruise ships highlight the risk of infection to cruise ship passengers and crew. Like many other viruses, COVID-19 appears to spread more easily between people in close quarters aboard ships. At this time, cruise ship passengers' operations remain suspended in U.S. waters under CDC's Framework for Conditional Sailing Order.